My name is Amr Azim. I am a reproductive endocrinologist at New York City IVF. I would like to explain today what is meant by IVF. In vitro fertilization is a robust treatment for the major forms and categories of infertility. It can help women that are trying to conceive due to a multitude of reasons, like problems with their fallopian tubes, ovulation, and male factor, endometriosis, polycystic ovaries, and many other issues. In that procedure, we stimulate the ovaries to produce multiple eggs to increase the chance for conception. The eggs are retrieved through a simple procedure without an incision and under deep sedation, and they are fertilized in the lab, and an appropriate number of embryos, one or more, are transferred back into the uterus. You should consider in vitro fertilization if you have a tubal disease, a blocked fallopian tubes. If you have a blocked fallopian tube, truly they can be fixed surgically sometimes, but the results are not as good as in vitro fertilization. You should also consider in vitro fertilization if you have male factor infertility that precludes using simpler methods, namely intrauterine insemination, like a small number of sperm and low movement or motility, and a high percentage of abnormal shape that hinders fertilization at the root. Some women that do not ovulate can also consider in vitro fertilization if they failed simpler methods or if it is safer for them to conceive this way. The indications has also been broadened to include the prevention of genetic diseases in siblings for known single gene problems, and it also, like sickle cell disease, and it also has been broadened to sex selection and donor eggs, and freezing of embryos for later use, and so on. Before you decide to proceed, there are many points about your reproductive health that you would need to understand. One of them, actually the most important piece of information you get from your reproductive endocrinologist, is ovarian reserve. Ovarian reserve is defined as the number of eggs and their quality that remain in the ovary at a given time. And there are a lot of individual variations between women. There are a group of tests that could be conducted before you even receive medications that will enable us to predict how you're going to respond and whether the procedure is feasible. One of them is looking with an expert eyes on the ultrasound of the ovaries and count the number of tiny small follicles in the ovaries. Another is through evaluation of proteins in the blood test. One is FSH and the other one is anti-Mullerian hormone. And then you would get a good idea of what would happen if you receive medicine and give your doctor an idea of what would be the dose. Another point of preparation is your partner should have a complete sperm analysis. The analysis should include the total volume, the movement, the concentration, and the shape of sperm, so that we would determine the fertilization ability of these sperms and the ability and how to use them. Because as we have fewer number of sperm, different procedures like injecting the sperm directly into the egg would be indicated. And the third thing that you would want to test before proceeding to IVF is to make sure that your uterus is ready for implantation. Some form of evaluation of the uterine cavity to indicate that it does not contain any polyps or no abnormalities in shape, septum, uterine fibroid bulging into the uterine cavity, and so on. And all these could be dealt with using a simple procedure before going to IVF. Finally, there are a group of tests not related to your ability to conceive, but related to the safety. One of them is genetic screening. Genetic screening, we try to evaluate the risk of genetic transmission of a disease that is common in ethnicity or in a population to the offspring. We would like to know what is the risk of that. And these are simple blood tests that are sometimes directed based on ethnicity or based on or a broad test that contains hundreds of genetic diseases and will give you some degree of assurance that these are not going to be transmitted to your children. And then you are ready to proceed.